Hello, my name is John Wright. Today I will discuss the overall benefits of JWLABS Model A. As I have indicated in a previous video, all users start out with what we call the beginner's routine. This is a very gentle session recording and is intended to provide results with almost any applicable condition in the slowest and safest way that we can devise. It is called the general alignment. The GA is 73 minutes in duration, is tuned continuously throughout the session via the recording. For the average user, 10 minutes is as much as is needed 3 or 4 times per week. This is continued for a week to 10 days for most people, but some will never need longer sessions or more advanced sessions and will continue with the GA indefinitely. The first effect that the new user experiences in most cases is an increase in energy. This is due to the body's uptake of electrons, which are converted by the cell directly into ATP. ATP is adenosine triphosphate. But in simpler terms, this is cellular energy. Beginner sessions are designed to give the user a boost, which is quite noticeable for most people. The next thing that most users notice is an increase in the immune system and a general detoxification. Immunity is increased simply by virtue of the stimulating effect that sessions have on the tissues of the body, including the blood. If undiagnosed conditions exist, they will often come to the surface and are thereby made more easily diagnosed. Immunity is increased simply by virtue of the stimulating effect that sessions have on the body, the tissues of the body, including the blood. If undiagnosed conditions exist, they will often surface and are thereby made more easily diagnosed. Changes in the blood can usually be easily verified by microscopical analysis, which can be accomplished simply by viewing the live blood before and after a short session under a dark field or phase contrast microscope. However, microscopical analysis is usually not necessary, as the effects are easily observable over time. Detoxification of the body is another effect of a beginner's routine, and it is achieved again by the stimulus of the tissues. The signal is delivered by means of current, which forces all cells of the body to do a small amount of whatever their function is, which makes the cells pump toxins out. Therefore, organs are encouraged to function better, and detoxification is a side effect of that stimulus. Over time, more and more work gets done, and as pathogens are destroyed, the immune system is strengthened as antibodies are generated. For the healthy person, this is all that is needed to overcome common disease, such as influenza, colds, allergies, joint pain, neuralgia, and many more. Usually within 3 weeks, the user will notice an increase in stamina, an improvement in their sleep habits, and a sharpening of their mind, even sometimes in their vision. Regular maintenance with the GA usually produces a slow but steady reduction in all the things that may afflict them, including many forms of chronic disease. After about 6 months of regular maintenance, the user becomes very resistant to common afflictions, and it is almost unheard of that experienced users will show any but the most fleeting symptoms of colds and flu. These effects are observed by young and old with a reliability of about 99%. We expect users to report any variations on these effects. In fact, results that are not expected should be reported immediately so that we can determine the cause and assist them in the solution. In most cases, when results are not as expected, it usually means that a new diagnosis is necessary. A simple example of this would be rheumatoid arthritis. In the classic case, virtually all users are able to have complete control of the progress of the disease within a few short sessions. They will generally purchase the rheumatoid arthritis title and use it to treat as needed to control pain, swelling, inflammation, and to arrest bone deformation. However, if the results are anything less than this, it usually means that there are other additional problems that have not yet been diagnosed. If rheumatoid arthritis is caused by Lyme disease, the rheumatoid arthritis applications will either not work well or will not work at all. The user would need to proceed with a Lyme disease application in order to eliminate the problem at its source. I should mention here that JWLABS is a research and manufacturing operation, and as such we cannot practice medicine, give medical advice, or perform therapy of any kind. Our job in this respect is merely to assist in the use of the machine for home remedy in a manner that is safe and produces the results that the user expects. Although there is an increasing number of practitioners who realize that effective Rife machines exist and are able to get better results with conventional therapies, including drug therapies, than non-users, the vast majority of MDs who have no scientific familiarity with the technique will regard them as useless and never take the time to investigate further. If the user's physician is supportive of the technology, they will more readily observe the improvements the machine can produce and can often be of more assistance in determining the rate of that progress. However, if the physician is not supportive, it is appropriate to allow them to consider the machine as a form of entertainment and nothing more. It is important for the user to know the position that their MD has taken in this regard, for the reason that the use of the machine and the results thereof will be confusing for them if they are not receptive. This can lead to some very serious problems. Also, it is usually necessary for users to take at least 5 days off from the therapy prior to any test or procedure by a test lab or their physician who is not complementary to the therapy. This is for the reason that although they are competent to determine the results of the test, they are generally not qualified to judge test results plus Rife machine. And they will often take full credit for the improvements in your condition purely out of ignorance. They could potentially make disastrous errors in judgment, not only of your progress, but they might change your prescriptions or order inappropriate therapy. Their advice, therefore, may be skewed, and this would not be fair to them or to you. Some years ago, one of our users who had been fighting what was then called full-blown AIDS had disregarded this advice and taken a full hour session immediately before his regular test for viral load. As we predicted, the results of the test indicated that he should have been in a hospital bed, curled up in a fetal position, and beyond hope. However, he was quite cheerful and full of energy. His physicians could not understand how he was able to even walk around. Had he stopped the therapy for a few days in advance, the results of the test would have been more accurate and more indicative of his true condition. A home remedy as important as this, as potent as this, and as inexpensive as it is not going to be stopped by the recalcitrant attitude of medical practitioners. For now, it is best for them to believe that your improvements are coincidence, placebo, or just serendipity. Thanks again for listening.